So what I'm going to do is to talk about this triple burden and share some insights from a new Lancet commission that was just published 2 days ago and had the official launch yesterday in the health conference in Berlin. So first things first, what I call the triple burden. So the two you see here are usually what you used to call the double burden. So it's countries that still face the burden of infectious communicable diseases, but it starts to see an increase in the burden of non-communicable diseases, including those associated to malnutrition. Those two conditions affect the entire lifespan from the prenatal period until old age. What we call the triple burden now is adding this set of conditions that are associated to shocks. So basically consequences of pandemics, climate change, and disasters, conditions associated to injuries and substance abuse, and the entire set of mental health illnesses that are included in this bucket. So that's what we call now the triple burden. And many countries are having to face all those three agendas at the same time. And I think the presentation we had in the beginning by Thomas kind of showed this a little bit. So let me share then now some insights of this new Lancet Commission that just came out. The idea is to basically propose what we're calling the 50 by 50 goal. So the idea here is to reduce by 50% the probability of a premature death by 2050, considering a baseline of 2019. So basically halve the probability in 31 years. What we are calling the probability of a premature death is a death before the age of 70. Now, where this come from? So basically, if we look at the data, we have about 37 countries that since 1970 were able to cut by half the probability of a premature death in 31 years or less, which is the time period we're considering for this 50 by 50 goal. In the graph here, you see 7 of those countries. They're large, but they have completely different contexts, and they all were able to reduce by half in less than 31 years. The length of time is different across those countries. Now, how we're going to do this? So the idea is to focus on 15 conditions. And of those 15 conditions, 8 are related to infectious diseases and maternal conditions, and 7 are related to non-communicable and injury-related conditions. How are those 15 conditions chosen? So here we go. Those are the 8 infectious and maternal on the left, and on the left bottom is the 7 non-communicable and injury-related. On this graph, what we see are everything in green is the contribution of the infectious and maternal health conditions to the gap in the life expectancy at birth between each one of the regions in this graph and what we call the North Atlantic, which is basically Western Europe and Canada. So US is not included in the North Atlantic because it performs much worse than the other countries in the North Atlantic. So we put the US separate in this picture. So everything in blue is the NCDs and the injury-related conditions. And there are 2 key messages here in this graph. The first one is we can see the changes that happened between 2000 and 2019. 2019 are the bars circled in red. So there was some progress achieved in almost 2 decades. The second key message is most of the gap in the life expectancy at birth between each one of those regions in North Atlantic is due to those set of 15 conditions, okay? And putting this into numbers, this is the gap. And we can see, for example, sub-Saharan Africa is almost 3/4 of the gap is due to those 15 conditions. And except from the US and Latin America and Caribbean, every one of those regions have more than 70% of the gap due to those 15 conditions. So to make it very clear, the sort of how we're going to do this, and I'll show this in a minute, comes with a recognition that there has been a lot of challenges to progress in global health. One is all the geopolitical issues we are facing. The second one is the increasing number and severity of the climate events with huge consequences for global health and for health systems, and therefore the ability of those health systems to respond. The whole issue of growing populism, and I think during the COVID-19 pandemic, we saw the consequences of this in different countries. The costs for healthcare are going up, and particularly there has been a sort of stalling in the progress towards universal health coverage. And so basically, when we're calling universal health coverage, is to have this package of interventions that reaches the largest number of people, reducing by almost zero the out-of-pocket expense. So this is the proposal of the report, is to condense the strategies to address those 15 conditions into 19 modules. And I just put the modules here, but the idea of having a modular approach is to recognize that this is not a prescription by any means. This is sort of a starting point. And there are different interventions that go inside each one of those modules. And then countries have to adapt the combination of interventions inside each module, considering the resources they have. And the idea here is that this particular package has to be done with public funds. So again, minimizing the out-of-pocket expense. There is a set of medications and drugs that should be provided also with domestic funding to address those 15 conditions. And I'm not going to go into detail on this, but there is an entire tool of how you can optimize, do a sort of cost-effective analysis considering the different interventions inside each one of those modules. The idea is that the interventions in those modules would first address those 15 conditions, and as progress is observed, then other conditions can be addressed. Most of those can be delivered in primary care. But however, there are other modules here that they focus on the quality of life. So there's an entire module just on strategies related to palliative care. And that's, again, those modules are addressing the entire lifespan from prenatal to old age. Another important thing is the role of taxation, and there's a lot of discussion about this. So one of them is to increase taxes on tobacco. And this is something that can make a difference in many different countries. And it has additional benefits in addition to addressing some of those 15 conditions. But if taxation is pro-poor, you can also have benefits for the entire health system and therefore for reducing the burden. The other thing is to cut the subsidies for fossil fuel. And again, this can have benefits way beyond just the 15. So the question is, how much is this going to cost to the countries? There is an estimate in the report basically saying that if you take a low-income country, on average, of course there are variations, but on average, it will require an additional 1.1% of the GDP, considering 2019 values. And if you're talking about lower to middle income countries, is about 2% of the GDP. Now, one thing, and I'm glad the session 5 will address this, is there is a session in the report where it's discussed this probability that we could have another event like we had for COVID. So the estimate here consider the likelihood of an influenza or coronavirus epidemiological emergency in the future. And the estimates were done considering a 1, 5, 10, or 55-year window period, and considering the number of deaths that could occur, excess deaths that could occur. So I think the discussion here is not if this will happen, it's when this will happen. And I don't think that countries are prepared for the next one, but I'm glad there's going to be an entire session to discuss this. So the last thing I want to talk about is the role of development of assistance to achieve the 50 by 50 goal. And basically, there are two ways this could happen. Those are important. The two ways this could happen is direct funds, but the direct funds channeled into improving the health system. So building up from the basis, so you enable those countries to do something sustainable and better. And the second one is to basically fund public goods, so you can support those countries to be better prepared to respond to pandemics, to develop technologies, to deploy those technologies, and to contribute to sort of curbing the possibility of spreading the antimicrobial resistance. So there's much more into the report. It's more than 50 pages. I'll be happy to address any questions that come at the end, but I think the one message I wanted to send in here is this idea of reducing by 50% the probability of a premature death by focusing on 15 conditions, 19 modules of interventions, and the cost that would be involved on this. So I'll stop here. Thank you.